Here we have, this is just a little bit of background for those of you who don't know me. I went to the University of Wisconsin, and I'm in mourning since we lost our football game yesterday. Then went on to med school at Loyola Stritch in Chicago, and then down to UT Southwestern in Dallas for some postdoc fellowships, and was on the faculty there for a couple decades. Then on to the Norwegian Sports College in Oslo, Norway for a while. And throughout this time period, I've worked with the U.S. ski team and a variety of other high-performance teams. Been to several Olympic Games as a coach and doctor. And so I was really impressed to run across a precursor for the Be Strong bands. And I must say I was skeptical at first, but this I was open-minded enough to try to follow these things along, and little by little I became convinced that this is really going to be a game-changing device and modality for health and fitness. And normally, while we say that, is usually to work out, we end up needing to do that no pain, no gain thing that we heard about a little earlier. And the problem is that every time we work out really hard, we do some damage to various parts of our body. We need that kind of exercise to be able to advance and to adapt. And this is the basic idea of the costs and benefits of training. And what we ran across is that these Be Strong bands or blood flow restriction training, if done in the right way, can end up minimizing the tears and damages that you get from muscle. It shortens the recovery period needed, and those muscles start rebuilding right from the get-go, and they get bigger and stronger. And so we've come up with a program where in 20 minutes with very light exercises, we can get a very good release of growth hormone, as well as reduced soreness, and there's fast recovery because we haven't done as much absolute work, and so we go up right from the get-go. And so a little bit about how this stuff works. When we put the bands on, what we're really doing is we're impeding or blocking venous blood from getting out of the extremity, and we're leaving the arterial blood to come into the extremity alone. So we set up this situation where the periphery or the extremity itself, its veins dilate and the capillaries dilate, and they become engorged because essentially there's a little dam that's been placed on the venous side, while the arterial side is being able to run in as fast as it can. And the kind of so what of this is that now any muscles that are exercising are not getting the blood flow and oxygen that they need to sustain these contractions. And if you look at this slide that we have up on the thing right now, it basically is measuring the amount of oxygen in muscle. And on the left panel is where we're just doing a series of arm curls with no BFR bands. And here you have things in the mid-60s starting out, and they go down to the mid-30s, and as you get warmed up, it's down into the 40s. And then when you stop, you end up having a nice recovery hyperemia. But in this particular experiment, we had a band on one side, over on the right side, and we had no band on the left side. And so this is doing the same work, but with a band in place. And here we're starting at more or less the same spot, but then as we have more and more pressure into the bands, we get a further reduction of that oxygen from the mid-30s down into the mid-20s, and then before you know it, we're down into the teens, and then right around 10. And when the muscle is this empty of oxygen, this is when you get that exhaustion feeling, that muscle burn feeling. And eventually, if this goes on long enough, you can't do another arm curl. And so this is this failure signal that we get, and this fatigue signal that we get, that is the hallmark of very effective maximal exercise. And the way that we know that this is happening is here we have this systemic neurohumoral response. So here's a muscle exercising with a band in place and doing arm curls, and this muscle burn that starts happening is being transmitted or communicated up into the brain via some nerve pathways. And what happens there is it rattles around in the brain a little bit, and then the brain decides that the body and the exercising muscle needs some help. So it sends out a signal that causes increases in heart rate, increases in breathing, and some increases in sweating. These things end up being a result of a sympathetic neural discharge, or an increase in sympathetic tone. And then in addition, there's coming out of the brain from the pituitary gland is in the minutes following this workout is an increase in growth hormone that has been documented in a series of studies. And this growth hormone goes everywhere through the circulation, and any muscles that have been exercising at all and any tissues that are involved in this are going to benefit from this anabolic hormonal response that comes out and bathes all of these exercising parts. And so this ends up being a very good way of minimizing the costs of exercise and maximizing the benefits of any kind of exercise session. And what we're really doing is we say that the Be Strong bands amplify whatever workout it is you're doing. And one of the things that we've seen in some of these situations is that there are some very nice cardiovascular responses that are associated with anti-aging, really. And here we have 3 subjects: a 50-year-old male whose resting blood pressure was 128/84, and over 6 months of doing Be Strong 5 times a week, it came down to 113/72. Now that actually, if you do some calculations, that's a mean arterial pressure of 99 to start, going down to 86, which was a 13% reduction in mean arterial pressure. And the higher the mean arterial pressure, the higher the workload on the arteries and the coronary arteries and the whole 9 yards of the cardiovascular system. So the idea of a 13% reduction in mean arterial pressure means wear and tear on his arterial system is less. And then we also see this with a 50-year-old female where her blood pressure was 140/80, a little bit on the high side, but not too bad. And then after 3 months of 3 times a week of Be Strong sessions, she's now down to 116/66. If you calculate the mean arterial pressure, that's from 105 down to 81, a 23% reduction in 3 months. This is really huge, and this is really a very good benefit to her longevity and her reduction in risk of cardiovascular disease. And then we have another young man at 75 who started out with a blood pressure of 150/82, and after 3 months of 5 times a week of Be Strong sessions is down to 111/66. And then putting in terms of mean arterial pressure, this is 100 down to 83, or a 17% reduction. So these are all meaningful markers of an improvement of health and fitness, and are one of the examples of how these things work. So to summarize, what we're really doing is we're impeding venous return, causing a situation where the muscles are really running out of gas and oxygen and building a little metabolic crisis, which causes some local adaptation. But then this whole process of that muscle burn is leading to a systemic response noted by an increase in growth hormone secreted, which ends up causing a amplification of all of the exercise that's been going on to date. And with that, I'll turn it back over to Mike and say thank you very much.
Dr. Stray-Gundersen, a couple questions here. Obviously, we're seeing improvements in hypertension, which is, typical with exercise, but we're seeing wonderful results. And this is a very common question, especially our people are getting without talking to. They're dealing with somebody who's got hypertension, who has some cardiovascular early disease, and they want to know, is it okay to use this? And here we're seeing people getting better. And I've heard this answer a bunch of times from you, but let's hear that again.
So one of the things is this ends up being a really nice way of reducing your cardiovascular risk factors, as well as getting healthy and fit. It's really anti-aging medicine, and we actually know that a lifestyle associated with regular exercise and proper nutrition ends up maximizing lifespan, and the part of your lifespan that ends up being active and healthy. And so this is just we're starting to see these effects in real people, and it's very impressive. It's you don't get these kind of results with the standard exercises that are around. With these Be Strong bands, we found a way of getting these benefits of regular exercise in a short duration and relatively infrequently, with lifting weights and doing exercises that are possible.
So is it safe to say that if anybody is allowed to exercise, meaning their doctor has not prohibited exercise and they have some cardiovascular concerns, that they are fine to use these bands?
Yeah, absolutely. And one of the things is the precursor of our Be Strong bands has been used in Japan for cardiac rehab. And they feel that it's safer than normal exercise, as well as even more effective, because now you're getting to get to that situation where you can get an exhaustive exercise bout that's going to turn around and produce some positive adaptation, but the durations and the absolute workloads are manageable and a lot less than the normal ones they use in cardiac rehab.
Different question. Why, for some of these people on here that are losing weight, like Rocio and Dr. Freeman and Evan, who are regular exercise people, and then all of a sudden they switch their workouts over to these bands, why all of a sudden do they see this rapid loss in weight, and at the same time they see increased muscle gains?
Yeah, it's really fantastic. I'm not sure I can completely explain everything, but I know that it has to do with changing the hormonal milieu that's ongoing, and we do know that these kind of exercises do release growth hormone afterwards. And then on the other hand, we also know that by giving extra growth hormone, that we can get some of these things like weight loss and improved muscle strength and that sort of thing. So it's likely that these exercises end up or when you're doing them with the Be Strong bands in place, they trigger the same kind of responses of the body that really maximal exercise does. And that goes for whether it's powerlifting all the way out to running marathons. So you end up being able to get the same benefits from all of those kinds of things without having to have 300 pounds over your head or run 20 miles every day.
And I know a lot of people who are trying to lose weight will appreciate this. You were telling me earlier that this lipolysis thing kind of kicks in gear. Tell us what that means.
Well, one of the effects of growth hormone is it's called a lipolytic hormone, meaning that it breaks down fat. And so this is part of the process of mobilizing fat stores to be able to be used as fuel. And we know that this is one of the common known effects of growth hormone.
So why? How is it a girl who's a volleyball player? How is it that she can be exercising in a regular program and then implement the bands and put 6 inches on her vertical? That's just unheard of.
Well, I think it goes back to this idea that the bands amplify the benefit of whatever workout is going on. And let's think that she did lose some weight in the process, and then she did get stronger. Now that combination, when it translates into a vertical jump, she's got more power and less weight, so she's going higher.
So I think how I hear you explain it is that when you add these bands, you're able to amplify or work the muscle to a further or harder failure than it's previously had, without damaging it, by the way, because you're doing lighter exercise, but you're taking that muscle into a further or more exhaustive failure. Hence, it has this really neat adaptation that we normally haven't seen before.
Yeah, the body reacts to the stressors that it's under, and if it thinks all hell's breaking loose out in these muscles, then it's going to do what it can to try to mitigate that problem. And in this case, the mitigation ends up being a powerful signal to build better and stronger tissues.
A lot of these people that are listening to this live recording and this live webinar and recording, they're not athletes, and a lot of the people they know aren't athletes. But what happens when maybe we just take a person who's a walker, they just go for light walks and they're really not seeing results? Why is it when they put these bands on and just start doing the same thing, maybe go for a light bike ride or go for a walk or just go up and down the steps, same thing they're used to doing, they start seeing, somebody like that can see these great results? And again, they're not in the gym working as hard as, say, this volleyball player, but they're just going for a light walk.
Well, it goes back to this same old thing where we used to think about no pain, no gain. But here what happens is by putting the bands on for just a regular walk, we're denying the blood flow of the we're denying the muscle of the blood flow that it needs to continue. And that situation, normal when we're younger or when we're training for things like marathons or that sort of thing, it takes us a lot of miles to be able to get into that situation where we can't supply enough blood and oxygen to our muscles. Here we have a way of doing that with relatively easy work, and because we're creating that crisis, then we get this anabolic hormonal response out of the brain. And the adaptation that it would normally take hard workouts to get, we get with these easy, non-damaging workouts.
So, like my mom's 78 years old, and she's been kind of paying attention to this, and she now wants to know if she can put the bands on and just go for a walk. She saw these great pictures of Dr. Chris Freeman, and she says, well, he obviously works out a lot, but she doesn't work out a lot. So how about our seniors, our parents, maybe our grandparents that maybe don't exercise a lot? Can they put these bands on and start getting results?
Well, this works not only for grandparents and parents, it works for us. And the idea here is that by the time we're, let's say 50 and over, we can't do the kind of workouts that we used to do that allowed us to get in the kind of shape that we used to be in. We just can't do those things anymore. Or if we try, we end up getting hurt. Or we have some sort of chronic injury that if we try to do those kind of workouts, it would flare that injury up and then set us back some more time. Here we now have a mechanism for being able to do very doable exercise and get the same benefits that we got from those maximal exercises in the past. And now everybody can do these things from, as we say, from 9 to 90, and enjoy the benefits of these kind of workouts.
Awesome. Well, thanks for answering those questions and sharing that with us tonight, Dr. Stray-Gundersen. Always great to have him on.